Good morning. My name is Laura Armengou, and I'm going to present the abstract titled Unilateral Subthalamotomy by Magnetic Resonance Guided Focused Ultrasound in Asymmetrical Parkinson Disease. The development of magnetic guided focused ultrasound as a minimally invasive technique has revitalized ablation as a treatment for movement disorders. Recently, two pilot studies showed safety and efficacy of magnetic resonance guided focused ultrasound unilateral subthalamotomy for the treatment of Parkinson's disease motor features. Our objective was to study the efficacy and safety of this procedure for the treatment of asymmetrical Parkinson's disease. This descriptive prospective open-label study was conducted at Clínica Universidad de Navarra in Spain between January 2020 and May 2022. All patients were selected from the Movement Disorders Unit and fulfilled the following inclusion and exclusion criteria. They were diagnosed with Parkinson's disease and had an asymmetric presentation with a good response to levodopa. Motor evaluations were undertaken by the same neurologist, while off medication and on medication stayed before treatment, and while off medication stayed at 1 month, 3 months, and 6 months after treatment. As a group of patients was also evaluated at 12 months. Adverse events or worsening of pre-existing symptoms were evaluated at each visit. A cognitive and neuropsychological assessment were done before and after treatment while on medication stayed. Because of the COVID-19 pandemic and the fact that some patients lived far away, we were forced to do online follow-up consultations in some patients. The primary efficacy endpoint was the change from baseline to 6 months in the MDS UPDRS Part 3 score on the treated antibody. The safety of the procedure was assessed by recording the frequency, type, and severity of adverse event at 6 months. Our secondary outcomes were the clinical effect of subthalamotomy on cognitive and neuropsychiatric symptoms, as well as changes in quality of life and levodopa equivalent levy dose. The statistical analysis was conducted with marginal means of mixed model, including times as the independent variable. P-values were calculated with t-test. In the table 1, we show the clinical and demographic characteristics at baseline. A total of 20 PD patients with a mean age of 61.5 years were treated. Their most effective site was the right one, and their mean duration of the disease was 7.2 years. Their mean levodopa equivalent daily dose was 737.5 milligrams. You can also see their scores in the MDS UPDRS Part 3 in both on-state and off-state. In the table 2, we can see the MDS UPDRS Part 3 scores at the baseline 1 month, 3 months, 6 months, and 12 months. As you can see, there was a significant reduction in the MDS UPDRS Part 3 for the treated antibody between baseline and 1 month, 77.7%, 3 months, 85.6%, and 6 months, 78.6% after treatment. In the subgroup that was followed at 12 months, the reduction in mean differences was also significant, 58.5%. The mean reduction from baseline in rigidity was 82.1%, and in bradykinesia was 69.4%. The mean reduction from baseline in total tremor at 6 months was 91.1%, showing a similar improvement in all types of tremor. Postural, 92.4%, kinetic, 100%, and rest tremor, 86.7%. In the table 4, we see the adverse events during and after treatment. All of them were of mild intensity, except for one patient who presented moderate weakness of the treated antibody. The moderate weakness was treated with physical therapy, gaining some functionality, but remained with some physical limitations at 6 months follow-up. During treatment, the most frequent adverse events were dizziness, headache, and nausea. All of them were not severe enough to interrupt the procedure, bearable, and well controlled with medication. 24 hours after treatment, the most frequent adverse event was unsteady gait, which was mostly resolved by the 3-month visit. In total, only 4 patients manifested de novo dyskinesia. All of them were of mild intensity except one which was moderate. 3 of them were in the off state and 1 of them in the on state. At 6 months follow-up, only 1 of the patients presented mild non-bothersome dyskinesia in the off state. At the 6-month visit, the most frequent adverse event was mild weakness of the treated antibody. The vast majority of adverse events that are listed in the table were completely resolved by the time of this follow-up. The mean levodopa equivalent daily dose at baseline was 737.5 milligrams and was significantly decreased at each visit, as well as the levodopa equivalent dose just for levodopa and only for dopamine agonist, as we can see in the table. 15 out of 20 patients completed the neuropsychological assessment, and after treatment, patients obtained significant better scores in visual memory and reduced significantly depressive symptoms and impulsivity. Moreover, worse scores were observed in semantic fluency and Stroop color word test, as we can see in the table. Finally, all patients reported clinical improvement at 6 months and 12 months. In the figure 2, you can see an example of a raised ophthalmotomy 3 months after the procedure. In conclusion, our results suggest that unilateral ophthalmotomy by magnetic resonance guided focused ultrasound is safe, and that the benefits on PD motor features are similar to those previously reported. More studies with higher samples are needed to be more conclusive about neuropsychological assessment. Thank you.